Hey there, welcome to the show. Today I'm talking all about progesterone, one of the most important hormones that you need to know about. If you didn't listen to my episode number 32 with registered pharmacist Carol Peterson, you definitely do not want to miss that. So go back and listen to it. And then, of course, listen to this one where I'm going to dive into some of the most common questions that I get. But before I do that, I do want to give you a little education around it because it really is an important hormone. Progesterone is one of the most essential hormones for women's health. It is critical for balanced moods, good sleep, healthy periods, and much more. And it's often referred to as the calming hormone because of its ability to soothe the nervous system, promote relaxation, and counterbalance the stimulatory effects of estrogen. Now, while estrogen is often seen as the dominant female hormone and sometimes unfairly blamed for symptoms like weight gain, bloating, and mood swings, it is not the enemy. We love estrogen. I say that over and over again. It really is vital for bone health, cardiovascular function, and cognitive sharpness. But we do need to counterbalance it with progesterone. So progesterone is typically the first hormone to decline somewhere in your mid 30s, which can be due to stress, diet, lifestyle, use of hormonal birth control. But of course, around the age of 35, we start having anovulatory cycles where we don't ovulate every month regularly, right? If we have healthy periods in our 20s and even early 30s, we should be ovulating every month, though this is happening less and less for women, again, because of diet, because of lifestyle, because of stress that we're all under, and the very common use of hormonal birth control. I used it myself for about 13 years. And what I was never told was that it slows down production of our own hormones. So now you know. But in your mid 30s, typically around 35 or so, is when you start to develop these anovulatory cycles where you don't ovulate all the time. So if you don't ovulate, you don't make progesterone. So you have to ovulate in order to make a robust amount of progesterone. We make a little bit all month, but it's just not enough to really have the profound effects that it could have on the symptoms that a lot of us are dealing with. So we can be losing progesterone sometimes years before estrogen levels drop. And this can lead to something called unopposed estrogen. You've likely heard the term estrogen dominance. It's all over social media, but it's not usually because estrogen is too high, although it can be recirculated in the body if you're not supporting detoxification or you are exposed to a lot of estrogen mimicking chemicals in personal care products, plastic, fragrance, and so on. But it's more so because there's not enough progesterone to keep estrogen in check. So without adequate progesterone, women can experience a range of symptoms like anxiety, poor sleep, irrational fears, low mood, heavy or painful periods, fibroids, breast tenderness, bloating, migraines, and even increased sensitivity to stress. And it's a little bit of a vicious cycle because progesterone helps us better adapt to stress, but stress halts production of progesterone. Because when we are under a lot of stress, what happens? Cortisol takes over. Cortisol is our stress hormone. When we're under a lot of stress, the body is like, we just need to keep this person alive. Our body doesn't care about ovulation or anything else for that matter. So this is why I believe that most women over the age of 35 who are struggling with any of the symptoms that I just mentioned should consider some form of progesterone support. So restoring progesterone levels can be life-changing for many women navigating perimenopause. It was for me, and I've shared my story many times. I started to experience symptoms in my mid to late 30s. The biggest ones were anxiety, and I was not somebody who used to experience anxiety. So I was like, what the hell is this? Just feeling super anxious, overwhelmed. Like I felt like I was losing my mind some days. I had really bad brain fog. I couldn't focus on tasks. I couldn't get things done. I was not sleeping well. Like I couldn't really fall asleep. I wasn't staying asleep. Started to get some hot flashes here and there at night. And just my mood was not good. And I also started to get heavy periods, which I hadn't had in years since I was like a teenager. So it was not fun, but it was a real wake up call. Like I said, in my my mid to late 30s when I started to experience all that. And I was like, okay, I guess we're starting perimenopause. Let's go. But one of the first hormones that I replaced was progesterone, and it really, really helped with my anxiety, my mood, my sleep periods, and all the other things I mentioned. And then later on, I added in estrogen, and then I added in testosterone. So I do want to talk about a couple of misconceptions about progesterone. One is many providers confuse progesterone with progestin. There are many doctors who will still give out progestins, or they will refer to it as that, and it can get really confusing in that conversation. And sometimes you may go and ask your doctor for progesterone, and you're thinking that they're giving you a bioidentical form, or one that is identical to the one that your body makes, but they may be giving you a synthetic one, and that stinks because you're probably not going to feel much better. They're just not the same, and don't let anybody tell you that they are. The other one is there's this myth that progesterone is only needed if you have a uterus. So the idea is that if you have a uterus and you take estrogen, you need progesterone to balance out that stimulatory estrogen to reduce your risk of uterine cancer. But as I mentioned, progesterone has a range of benefits. So even if you don't have a uterus, you would still benefit from it if you're dealing with any of the symptoms that I mentioned. The other thing is that some people will say, well, if my estrogen is low, like in late perimenopause or menopause, a doctor may say progesterone isn't necessary because you don't have to really counterbalance it. But that's not true either because of everything I just mentioned. It has a lot of benefits as we age. But, even if you have just low estrogen, you could still have estrogen dominant like symptoms because it's unopposed, because you don't have any progesterone there to counterbalance it. I hope that makes sense. So let's move on to some of the different forms of progesterone. So there's oral micronized progesterone, which if you go to like a standard pharmacy, the FDA approved one is known as Prometrium. And many women do well with this, but it does have peanut oil. I believe it's yellow food dye, and some women react poorly to it. So there are other options, luckily. Like if you go to a compounded pharmacy, you can get compounded progesterone, and you can get that orally in a pill or topical, like in a cream. There's also something called troches that you just put on the side of your mouth. And then there's also like a vaginal application. Typically that's done in a cream. So there are different options, because I know a lot of women will say, oh, I tried progesterone and I felt horrible. And I always ask, well, what kind did you take? Was it compounded? Was it FDA approved? Was it a pill? Was it this? Was it that? And I try to just get as much information as possible, because a lot of women will think that they can't tolerate it. And that's not really the case. There's a lot of moving parts there. And that's why I do what I do with clients, where we're looking at underlying imbalances when it comes to your nutrients, your minerals, your detox pathways, and so on. So there are some pros and cons to the different forms. I'm not going to get into all of them, but oral progesterone is typically really good for sleep and anxiety. However, it can have a sedative effect. So you may feel groggy, dizzy, or even like depressed, have a low mood. Some women say, oh my gosh, I tried oral progesterone and I got really depressed. And that's really unfortunate. But again, there are other options. Some women will actually insert the oral capsule vaginally, and they feel better doing that. But again, it could just be that you need another form. You need a compounded formulation. Personally, at the time of this recording, I am taking a compounded formula sustained release. So it doesn't make me feel drowsy. I just start to slowly get tired at night when I take it before bed, and then I fall into a deep sleep. However, if I don't take enough estrogen, then there are nights where I do wake up. So I'm not talking about estrogen right now. I think I'm going to do a totally separate episode on that to answer some of those common questions I get. But I really do believe that both of them need to work in tandem at a certain point, usually in your 40s or beyond. If you're still in your mid to late 30s, you probably would just benefit right now from some progesterone if you're dealing with any of the symptoms that I mentioned earlier. All right, moving along. So the other question I get is, can you support progesterone naturally? Well, If you're on the younger side, you can, of course, I mean, you should be doing this no matter what age you are, but if you're on the younger side, you may have a better chance because your ovaries are still like, oh, we're still working. But in your 40s and beyond, your ovaries are like, nah, I'm retired. Like, I don't want to do this anymore. So if you're on the younger side, you can obviously, focus on your diet, making sure you're getting healthy fats, eating a high protein diet, watching your carbohydrate intake, making sure you're eating complex carbs, lots of fiber, just like quality organic fruits and vegetables, obviously if budget allows. And then you want to be managing your stress as much as you can in this crazy world that we're living in. But the other thing is there are some supplements that some people will recommend, like magnesium, B6, zinc, and even some herbs like Vitex. Those things can support production of these hormones. We need nutrients to produce hormones and for our hormones to function optimally. And those things still apply as we get older, right? Most of our clients are on some form of magnesium, B6, and zinc in some sort of mineral complex. We don't typically use herbs in this stage of life because we don't find them to be enough. And they don't replace hormones, okay? Our body at this stage, 40s and above, we're starting to lose our God-given hormones, okay? Hormones replace hormones. Herbs do not. Another question I got is, when is the best time to test progesterone in your cycle? So I've talked about testing hormones in the past. There's a lot of people that butt heads in the online space. I don't have time or energy for that. I just know what I know based on all the things I've learned over the years and what I've learned in clinical practice with clients. We have run many, many, many hormones tests. And in women in perimenopause, it is not always reliable or accurate. Okay. So it's not always in your best interest to spend hundreds of dollars on a hormones test. So testing progesterone or even estrogen, especially in perimenopause, can be very tricky because they fluctuate a lot. So like I said, you have anovulatory cycles in perimenopause where some months you may make progesterone, other months you may not. So you may get a test one month and it looks like you've got enough progesterone, but if you were to go back and test the next month, you may not. So your doctor may look at that and say, oh, you're fine. You've got enough progesterone. Meanwhile, you're like, I feel horrible and I'm 40. So this is why testing can be kind of tricky and can negatively impact the treatment plan that you get if a provider is reading it and isn't really hormone savvy. That said, if you are going to test because you're somebody who's like, I want to see the data, or you have the money to spend on a hormones test, you could also do this via blood. We do have our clients do it if they want to. If you have a 28-day cycle, like a regular 28-day cycle, then you would test between days 19 to 21. If you have like a 30-day cycle, you would just add a couple days to that. So then it would be like days 21 to 23. And I'm saying you just pick one of those days. You don't need to test it on every one of those days. And then you see what you see, if you really want that data. All right, another question I get is oral progesterone better than topical? Not necessarily. Like I said earlier, there's pros and cons to all the different forms of progesterone or applications. I personally prefer oral. I just find it really easy. I take it at night. I sleep like a baby. It helps with my mood, with anxiety, and so on. Some women don't really tolerate it. They get really groggy. Sometimes that's a matter of taking it a little too late at night if you feel groggy the next day. Some women benefit by eating it with like some sort of healthy fat, like a nut butter. That can help you absorb it properly. Again, there's a lot of tricks, and these are the things that we guide our clients to. That's why we coach, right? When women start their HRT journey, there's a lot of questions that come up. Sometimes they don't feel so good, so we are there to support them through it, especially if their provider is not all that savvy, which unfortunately is pretty common. The other thing is, in regards to topical, it has its place, okay? It's very dependent on the individual. Okay, another question that I receive is, can progesterone trigger estrogen-like side effects? You may have heard a term estrogen kickback. Yes and no. I mean, listen, anytime we start hormones, be it estrogen, testosterone, or progesterone, we may notice symptoms because we're waking up our hormone receptors, especially if you're somebody who has been in a low hormone state for some time. So if you've been feeling pretty lousy for years, I can almost guarantee you don't have optimal hormones. So once you add them in, you may be like, ooh, not feeling so good. Maybe your boobs hurt a little bit, or your periods change, or you get some headaches. But please know that there is a trial period, and you want to work with somebody who understands hormones and can guide you through that process until you optimize your dose, application, and so on. I personally felt like a new woman when I started progesterone, and I know that's not always the case for others, but many of my colleagues also feel really good when they start, and I really do believe it has to do with your foundation going in, meaning if you start hormones and you have not supported your gut health, you have not supported detoxification, you have not done any nervous system support, if you have not addressed mineral deficiencies, then you probably won't feel good. So it really is important to do all the things that I talk about all the time, right? Hormone replacement therapy is amazing, but it's one piece of the puzzle in midlife health. Another question I got is, could too little progesterone cause cancer? And how do I know what dose I need? If you're taking estrogen, then you do need to take progesterone if you have a uterus, and that's going to protect against uterine cancer. But like I said earlier, there is a myth that if you don't have a uterus, you don't need progesterone. And technically, yes, that is true. You don't need it because you don't have the uterus that you would get uterine cancer. So there's a lot of providers who will just give women without a uterus estrogen alone. And sometimes that's enough for them. But there's a lot of women who are still experiencing symptoms, and that's where progesterone can really help. Now, in terms of the dose, I have no idea what somebody's dose should be without working with them, without talking to them. And obviously, this is something that your provider, the one who's prescribing, needs to figure out with you. But the minimum is 100 milligrams, and you want to be taking it 12 days per month if you're taking estrogen to, like I said, protect that uterine lining. Now, if you're not taking estrogen, then you can take as little progesterone as needed. There's a lot of over-the-counter topical progesterone creams available. They have them as low as 20 milligrams, some as high as 50 milligrams, or even 100 milligrams. So you can certainly experiment and see how you feel with those over-the-counter ones. So on that note, somebody asked me, do you like over-the-counter progesterone? So there are some really great brands out there. We have actually recommended some to our younger clients who are just getting started. Maybe they have like really bad periods or fibroids, and they don't necessarily want to start a prescription progesterone or have to look for a provider who's going to prescribe it. So there are some good brands we like. One in particular is called Ona's Natural. It tends to have a higher dose, so I will link to that in the show notes. All right, the last question is, should you cycle progesterone? Believe it or not, this is one of the most controversial topics in the hormone replacement therapy space. It's kind of bananas to me. In my opinion, it's a matter of what each woman needs. Some women feel really good when they're just taking it half the month. So typically that's going to be in your luteal phase, around days 14 to 28 of your cycle. And then other women feel lousy all month, and they benefit from taking progesterone continuously. Now, if you're going to do continuously, your provider may suggest that you take a break, like 3 to 4 days, to give your hormone receptors a break. That's something that I actually am very aligned with. I just see that with most of our clients. A lot of them start off with the days 14 to 28 or half of their cycle because their provider told them to, and then they notice that they feel really good when they're on it, and they're like, I want to take it all month. So a lot of them will talk to their provider about taking it longer. All right, I think that is all I have for you. And if you have any other questions, feel free to send me an email. But if you need support in this stage of life, do not hesitate to check out my program, the Perimenopause Method, where we dig into your detox pathways. We talk about your gut health. We look at your minerals to make sure that they're balanced, because like I said, your hormones need nutrients to perform their best. And we give you a ton of education about women's health and ongoing support so you get the results you desire. All right, until next time, have a good one. Hey, before you go, if you're resonating with this podcast and realize that your symptoms are anything but normal, my comprehensive program, the Perimenopause Method, may be a great fit for you. My team and I help women in their mid-30s to early 50s improve symptoms such as fatigue, disrupted sleep, anxiety, erratic moods, bloating, and much more. We do this by utilizing advanced testing, a personalized plan tailored to you, women's health and hormones education, and ongoing support so you never feel alone and you get results. If you're ready to commit to your health and feel like yourself again, but even better, check out the link in the show notes to learn more about the Perimenopause method. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.